Democrats call it landmark legislation that paves the way in Connecticut for universal health care. But does it really? Last week, Democrats flexed their muscles at the state capitol, overriding 7 of Governor Rell's 20 vetoes, one of them bringing the sustenance plan back to life. It was almost as if you could hear a pin drop in the House chamber as the votes were being tallied. For House Speaker Chris Donovan, the stakes were high.
The clerk, please announce the tally.
In the end, the votes were there in both the House and the Senate to override the governor's veto of the sustenance health care reform plan. And for Donovan, it was his first veto override with 1 vote to spare.
Yeah, it was nice.
But the speaker says the real winners are the people of Connecticut.
Well, they'll know that the people in the House and Senate are listening to them when it comes to health care, and we're working for them.
Democrats call the sustenance plan a real path to reform and the state's closest step ever to universal health care, which would eventually create a public pool for people to buy health insurance regardless of their medical history.
This begins the process that makes health insurance more affordable for more people.
And for those of you at home right now in desperate need of health insurance, don't think of this plan as an end-all be-all. In fact, it could be years before sustenance actually goes into effect.
That someone who's waiting right now for coverage, who can't afford their commercial coverage, is looking for another option, is not going to get relief in the next year. But what they do need to know is that finally we are on the right path.
Sustenance puts a panel in place to study health care reform and come up with a recommendation by 2011. Senate Minority Leader John McKinney says the state of Connecticut should not be in the business of selling insurance.
The sustenance plan costs the state of Connecticut over $1 billion. What the Democrats have done is they've pushed that plan out 2 years because we can't afford it in this economy. Quite frankly, I don't think we're going to be able to afford it, period.
And here now with more on what sustenance really means are Ms. Christine Stewart with CTNewsJunkie.com and Mr. Chris Keating, the Capitol Bureau Chief from the Hartford Courant. Thanks very much for being here, guys. So this is where I'm a little confused. The governor says that this has $1 billion price tag. I asked Donovan how much this would cost, and he said it won't cost anything. It'll save millions. McKinney said by pushing this off for 2 years, it's just pushing off the cost to hopefully a time when they'll be able to afford it. So, I mean, have any of you been able to gauge this yourselves?
I think that it was purposeful that they did push it off because they knew it was going to be a tough budget year. They knew the state had a deficit, and so they needed to come up with a fiscal note that said it cost $0. So they're in the planning stages for the next 2 years.
Right. McKinney also said that if it did cost money, you would not have had the override. You would not have had 24 votes. If it was going to cost $1 billion next year, the Democrats would not have overridden it because they wouldn't have had the votes.
But this is the problem I have with it then. The problem I have is, wow, this is landmark. It's paving the way for universal health care. But guess what, folks? If you need health insurance like in a month, a year, even 2 years, this isn't going to help you. So what is it that they're going to be doing?
Within 15 days after the legislation passed, they have to come up with the volunteer board of directors. And everybody has appointment powers. You have the governor, you have the minority leaders, you have the majority leaders. Everybody appoints somebody to this 9-member board. And that 9-member board then sets up the system, the framework for what will be the state-run universal health care plan.
So this truly is the path to universal health care based on what you're hearing.
It's not really a study group. It's a study group with a preordained outcome.
With
they
powers,
know what the
too.
conclusion is.
They're
right.
not just there
They know
to
what the
talk and have
conclusion
coffee.
is. They know who's going to be on the board. But the bottom line is, you're correct. You can't sign up for this till July of 2012, which is 3 years away. July of 2012 is when you can sign up.
So it's something to look forward to, I guess, if you could afford to wait that long. That's the problem.
If the federal plan goes through, that kind of supersedes this. So if the federal plan goes through, and that's not going to happen at least until the fall, because they just pushed off these votes that they will be beyond the August recess, there is a provision in the sustenance law that 60 days from when any federal plan goes through, they have to come back with a recommendation on how Connecticut's plan would dovetail with the federal plan.
And that was one of my questions, too. Why is the state spending time on this if the federal government was going to come up with its own universal health care plan? Christine, maybe you can talk about that. From what I gather is they say they need to have all their ducks in a row to be ready to administer a universal health care policy, whether it's from the state level or the federal level.
Right. And so by setting up this board, they have a way of accepting funds, if funds come with it from the federal level, of implementing policy, if policy comes down from the federal level. So it makes Connecticut, as Chris Donovan would say, Obama ready. So it puts the state of Connecticut in a good position.
And also, if the federal plan falls through, Connecticut has this plan. I mean, everybody's assuming that the federal plan will happen, and it probably will. But if the federal plan falls through, Connecticut will have this plan.
What about when Senator John McKinney says that the state of Connecticut should not be selling insurance? I mean, that's what he is saying, that the state can't afford to do this. However, what's the other side saying? That the state can't afford to not to do anything, right? Because of healthcare costs are skyrocketing. It's very complicated.
It is complicated and it is expensive, and there were questions on the floor of the House to which the answer was, I don't know. I mean, the whole thing is not completely nailed down. What this study group has to do is come back and bring recommendations back to the legislature. So the legislature gets to vote on this again, and they also will have to vote on the funding mechanism on how you fund it. So it's not over by any stretch.
Yeah, it could be killed further down the road.
Potentially.
Potentially. Mm-hmm. We only have like a little time left here. I want to talk about the budget. 88% of those people polled at the latest Quinnipiac University poll said that not having a budget is a pretty big deal, as it should be. Do we have any, are your sources telling you anything as far as how talks are going as this blackout period continues?
I'm not hearing anything. I mean, there has been a media blackout, and they haven't been talking very much. And who knows what's going to happen. I think that we're going to see another executive order by the governor in August. We're probably not going to see a finalized budget until Labor Day.
Keating, in all your years at the Capitol, have you ever seen a blackout with the press go this long?
Not really. It's kind of a long blackout, but I am hearing that there's certainly nothing imminent. You don't have to worry. You can go on vacation next week if you want. There's nothing imminent. It's not like the legislature is going to come in and vote on the budget. There's no deal to be signed, to be hatched in an imminent way. Will it eventually happen? Yeah, it'll eventually happen. That's what we assume.
If they would tell us anything, I mean, again, as I said last week on the show, I think the blackout period, I can understand that they don't want to try to fight this in the press, but the public in the same breath has a right to know what's going on.
I think there's a question about whether they're going to be raising taxes on everybody or they're going to be raising taxes on just the wealthy.
Or just reporters.
That's the dilemma.
That's why they're not telling us anything. All right, thanks very much, you guys. It was nice to see you. Glad I could get you to smile after all of that.
There you go.
All right, thanks.